Hello and welcome to Ipsos's Understanding Society edition on the future of public services. My name's Kate Duxbury. I'm a research director in the health and social care team at Ipsos. The topic of today's conversation is the future of the NHS. And joining me today to talk about this is Tim Gardner. He's the Assistant Director of Policy at the Health Foundation, which is an independent charity which is dedicated to bringing about better health and care for people in the UK. So it's been a big year for the NHS. We celebrated its 75th anniversary in July, and that was on the back of what had been a really challenging winter for NHS services. I think it's fair to say it's a public service that the public are really concerned about. So it's much loved, but at the same time, the British Social Attitude Survey shows that satisfaction with running of the NHS is at its lowest level since that survey started in 1983. With just 29% of the public satisfied, but 51% dissatisfied. The polling that we do with the Health Foundation also shows a level of pessimism about the future of the NHS. So in May 2023, 54% thought that the standard of care in the NHS would get worse over the next year, albeit that is a bit of an improvement since November 2022. So Tim, the public are worried, satisfaction is low. Could you summarise for us, where is the NHS at the moment? Does that reflect what's actually happening in the NHS?
It's quite a strong reflection of what's actually happening. So the health service is currently under really severe pressure. GP practices are inundated despite delivering record numbers of appointments. Hospitals are overcrowded with delays discharging patients because of a shortage of community and social care, leading to long waits at the front door in A&E and for ambulances. The pandemic left the NHS workforce overstretched, exhausted and demoralised. What we've also started to see is that the unprecedented industrial action by health service unions that began last November has intensified. While COVID-19 is no longer threatening to overwhelm hospitals in the way it was in 2020 and 2021, the virus hasn't gone away and is continuing to put additional strains on health services. But the roots of what we're seeing now go a lot deeper than the current industrial action or even the pandemic. The health service went into 2020 after a decade of austerity with long-standing staff shortages and a growing backlog of critical maintenance. Now, these issues aren't unique to the UK, but compared with other countries, the health service works with relatively few doctors, nurses, hospital beds, and other key pieces of equipment like MRI and CT scanners. Now, to some extent, before the pandemic, we were able to manage this relative lack of capacity by keeping hospitals pretty full and discharging patients quickly. But the surge in acutely unwell patients in the first couple of years of the pandemic put the health service under really enormous strain. And it means that we're facing a bigger backlog of delayed routine care to catch up with. And this is all in the context of a population with growing health needs.
Okay, so definitely a challenging time reflecting how the public are feeling about it. I wonder then, if we look to the future, I mean, what does that mean? Do we need a fundamental change in the NHS and how it's set up? Does it just need more funding? What do you think it needs?
So the current situation is the result of political choices made over the last decade and more. So what we're going to need is a mix of change and investment. There are more of us. We're living longer, but we're not necessarily in better health. You know, more of us are surviving acute illnesses and injuries that would, in years gone by, quite possibly have been fatal. But the changing burden and nature of disease, moving away from short episodic acute illness to long-term conditions that need to be treated but often can't be cured, means we've generally become sicker and more complex over time. And in many ways, this is a marker of the health service's success rather than a sign of its failure. But that also means that the changes that we need to see are more about evolution than revolution. In the wake of the pandemic and record levels of dissatisfaction by the public, there have been some growing calls for quite radical reforms, usually to how the health service is funded. People have suggested, for instance, charging for GP appointments and A&E visits, or moving to a system of social health insurance like in France or Germany. But how the health service is funded is actually one of its really key strengths. Tax is a relatively fair and cost-efficient way of raising money, and it spreads the burden of funding healthcare across everyone. While there's often an assumption that we use the health service too much because most services are free, there's actually no compelling evidence that people in the UK use healthcare more than people in countries where there is much more of a direct link between cost and service use. Equally, we can't go on as we have been in the past. Policymakers have often sought to reduce the costs of running the health service by cutting management, reducing bureaucracy, changing structures. Actually, by international standards, the health service has never been an especially expensive healthcare system. We've generally resorted to cutting bureaucracy and restructuring a lot over the last few decades. So there's not a huge amount left to cut. And actually, some of the problems that we're seeing now, in fact, many of the problems, are the result of a lack of investment made in the name of delivering efficiency savings.
Okay. I wonder then, what are the one or two key things you think the NHS could do to do things differently and protect itself for the future?
So unfortunately, there aren't any quick fixes or exciting big bang changes. The good news, though, is that we know pretty much what the solutions are. What we really need to see is a long-term plan to support innovation, boost productivity, and provide the health service with the resources, the capacity, and the technology it's going to need over multiple years. But the NHS was never set up to go it alone. Many of the solutions lie outside the boundaries of the health service. This includes proper reform of adult social care, which has been neglected by successive governments, and changing this is going to be critical for the people, families and carers who rely on social care, and it will also make a major contribution to reducing the pressures on the health service. Plus, we also need to see long-term political action to address the fraying health of the UK population. Protecting and improving people's health is not just about what the health service does. It depends on a much wider system of services and support that includes local government and social security. But people are falling between the cracks of those public services, and it's the health service that's often left to pick up the pieces.
So we do have an election coming up in 2024, and the NHS is always a key battleground in the election. It's a key topic for people to be thinking about. So, for example, our polling shows it's one of the top issues that will be most important to the electorate when helping them decide which party to vote for, alongside inflation. How are the policies of the parties aligned to what you think needs to happen to secure the future of the NHS?
So the health service is clearly a very high priority for all of the major parties at Westminster, especially as we head towards the election. But so far, we're really yet to see either the Conservatives or Labour set out a full policy platform for health and social care, recognising that the solutions don't lie entirely within the health service. The government's policy plans for the NHS are now relatively well aligned to the public's top priorities: workforce, hospital waiting times, access to general practice. And those also align pretty well with what the health service actually needs. But those ambitions are mostly about the short term, and they'll need to be backed up by wider action and investment if they're to make a real difference. And we don't really know very much yet about what the Conservatives would plan to do after the election. Labour has started to sketch out some plans for the next Parliament, although we're waiting a bit more detail about how those ambitions will be made a reality. So, for example, delivering more care in the community, improving hospital performance are absolutely fine ambitions, but they've also been the priorities of successive governments. We need to understand what a Labour government would do that would make things different this time. And quite importantly, neither party has really committed, or made any real noises about committing to the extra investment that is really desperately needed in the health service after a decade of austerity. While money is only part of the answer, it does mean that the next government is going to face some very difficult trade-offs about where to target limited funding and other resources, or how to raise additional revenue to spend on healthcare.
Challenging, I think, Tim, when we've got a public who want to see results, they want to see the NHS doing better for them. In fairness to the politicians, some of the changes that you've described are big long-term changes that will take time to enact. It will take time to filter through to better experiences again for patients. I wonder if you want to talk a little bit about the deliberative research that we've got coming up, which will look at those type of topics.
Yeah, so exactly with that in mind, knowing that this is not going to be a short-term fix, regardless of who wins the next election, the new government is going to face pretty much the same situation as the current one does, both in terms of the health service and also economically as well. So the challenge won't go away. It is possible to make some short-term improvement, but actually the solutions are fundamentally long-term. So really key challenge for whoever is leading, whoever is in number 10 after the election is going to be, how do you keep the public on board for what you're going to do? How do you give people the confidence that you're doing the right things now that will result in a better situation in 4 or 5 years' time? And that's going to be really quite difficult because the constraints on the health service, the growing, on the one hand, the growing needs of the population, on the other hand, the long-standing shortages of staff, years of underinvestment. That's going to take quite a long time to fix. And we might be looking at interventions that are costly up front, but will only really start to show a benefit in a few years' time. Equally, there might be other interventions that are more about arresting the rate of decline, rather than releasing and unlocking instant or even meaningful improvements over time. So actually, it's almost that the comparison is with the decline that would have happened rather than things just bumping on as they are. Makes it really, really tricky for a future government.
Difficult to explain that to voters when you're asking for their vote. Okay. I wonder, Tim, do we have any reasons for optimism about the future of the NHS?
Well, there are always reasons to be optimistic about the health service. We know that it's a much loved public institution. It enjoys a huge amount of public support. We have got the fundamentals of what could be a very high performing health system. The funding model that the health service uses, the fact that it's a service for everyone, that it doesn't put up lots of financial barriers in the way of people being able to access care, as we see in a few other countries. These are all enormous strengths. We've also in the past done a lot of experimentation with different ways of trying to run services, of trying to run the health service in a way that improves quality for patients and improves the productivity and efficiency of services. So there's a huge amount of learning that we can potentially draw on. We don't need to go looking for brand new solutions. We kind of know what they already are. And I think finally, the thing that gives me optimism is that the health service has been in a pretty bad state before. And it has, with sustained policy attention and investment, been able to really transform the services that it offers to patients. And we kind of saw this back at the turn of the century, where waits of 18 months for routine hospital treatment were not uncommon, and actually that was cut to less than 18 weeks. So the health service has done it before. With the right resources and political support, it can do it again.
And certainly with public support, because again, our polling shows people are so behind the model of the NHS still, the principles of it being funded by tax, available to all, etc., still very much supported.
Absolutely. We don't need to be having those debates.
Lovely. Okay, well, that leads us to the end of the interview. Thank you so much, Tim, for joining us today and outlining your thoughts on the future of the NHS. It's a public service that's so important to so many of us. I look forward to hearing more from you and from the Health Foundation as we progress towards an election next year. Thank you very much.
Same here. Thank you.